The region does have several opportunities for improvement, including 2009 construction began on a modern hospital at Johns Hopkins. The new addition will add 96 adult intensive care rooms, and it will also include new emergency departments, children's trauma, and burn services. The region also received funding to restructure the cable system. Funding for this program was available through a federal grant awarded to the Maryland Emergency Management Agency. The grant was awarded in fiscal year 2011, and the funds may go toward restructuring the vulnerable communications system. The project started in 1985. Healthcare for the homeless has been instrumental in reducing emergency room overcrowding in Region 3. Funds for planning, organization, equipment, training, and exercise needed to protect, respond, and recover from acts or threats of terrorism have been given to the region. In fiscal year 2009, Region 3 received funding that may be used to expand disaster training across the region. Region 3's communication system has come under scrutiny. Outdated and exposed systems threaten to disable the region's communication. In a state budget report published in 2011, the system was critiqued. In the future, anticipating the emerging needs of Region 3's growing population may threaten the performance of the system. Without identifying possible emerging issues of the increased population, system weaknesses may threaten to weaken Region 3's performance. Economic disparities coupled with a growing population pose a threat to System 3's performance. Region 3 must meet the challenges associated with serving the increasingly changing demographic. All modern emergency medical systems are faced with the threat of responding to an unexpected disaster. Region 3 is no different. The region is still vulnerable to specific types of disasters. Among these are chemical and biological. As of this report, chemical and biological disaster response training is not required by a percentage of EMS providers in the region. When considering system changes, public policy must also be considered. Several lead agencies will participate with the emergency medical service providers and enact systematic changes. For instance, the Department of Health and Human Services is responsible for issues concerning public health. When considering environment factors such as population shifts, this agency will work with EMS providers to incorporate change within the system. In today's society, the Department of Homeland Security is capable of assisting with policy changes. In Region 3, this department may be capable of assisting with Region 3's vulnerable communications cable system. Policy changes would prevent hazards such as construction from endangering the region's communication system. To meet the changing needs of special populations, local agencies such as the Baltimore City Department of Health can provide policy guidance to EMS service providers. The Department of Homeland Security and FEMA are two lead agencies that affect national policy options as the system continues to create changes that protect the public from acts of terrorism. The State Emergency Medical Services Board was created in 1993. This board evaluates the efficiency and effectiveness of the Maryland Institute for EMS. In meeting minutes from 2011, the board reported that the system made several improvements and has increased efficiency and effectiveness in the region. The board reported that the county hospital alert tracking system was upgraded, and the new software applications are now compatible with hospitals, and they are less vulnerable to hazards. In addition, the board reported that 90% of beds in shock trauma are occupied. However, the board also reported that the construction of additional hospital space will help to alleviate the high occupancy rate. The effectiveness of the system continues to improve. The web system, the Facility Resources Emergency Database, FRED, is now in operation. The system is improving efficiency by tracking EMS responder ability. The Facility Resource Emergency Database allows dispatchers to assign the appropriate relief to emergency calls. Funding should be used in Region 3 to expand health services for those living below poverty. The Baltimore City Department of Health will be instrumental in policy changes and demographic information. Continuing to make health services more visible will be vital in continuing to improve emergency room efficiency in Region 3. Region 3 must continue to coordinate for disaster preparation, work closely with both FEMA and the Department of Homeland Security to continue to lead the United States in EMS mandated disaster preparedness. The region continues to upgrade communication systems, and although compatibility hazards have been reduced, the equipment must be continuously re-evaluated to ensure statewide compatibility. Rapid growth must be monitored, and system components must be annually analyzed to ensure peak performance. In the future, the demographics of Region 3 will dictate the role of EMS service providers and dictate the needs of communication services. In Region 3, continuous improvement to the emergency medical system will ensure that the agency stays aligned with its mission statement. Instituting a plan for upgrading the EMS communication system will result in a modernized communication system that is streamlined. Increasing visibility of needed services within the region will reduce public endangerment and will bring the agency closer to its ongoing mission of maximizing public safety through emergency and non-emergency health services in Region 3.